Getting the best surgeons in the world to perform your medical procedures could soon be a video link away. Researchers at Florida Hospital are hard at work.
They are using video simulators to test the limits of telesurgery. But Local 6's Mike Holfeld found doctors will face a new challenge.
We're actually talking about long-distance robotic surgery. Think about it. The patient in Orlando, the surgeon in Boston, or even Paris. The theory is being tested right now in virtual ORs.
You're watching a trained surgeon.
I don't know why it's not cutting that one.
Performing virtual surgery with a subtle disadvantage.
This one I seem to notice it more.
Programmed latency or motion delays.
At some point, the surgeon will notice that his movements aren't responding as quickly as he's used to. See, I'm having trouble moving my hand to the right spot to grab the ring.
Researchers have found the greater the distance between surgeon and patient, the slower the reaction from surgeon to robot. Right now, 200 milliseconds, the blink of an eye, is the limit.
The 200 milliseconds, what kind of distance do you think that represents?
I'm thinking 300 miles.
300 miles. That's about the distance between Orlando and Savannah, Georgia. Yet the standard for today's robotic surgeons is far less. Surgeons guiding high-tech scalpels with their patients a room away. But what if the patient needed a doctor beyond that room, say 300 miles or 3,000 miles?
Some of them finish the exercise successfully, and others stumble and fail at several of the tests before they get it right.
For Florida Hospital's Dr. Roger Smith, that's the challenge.
Over time, they just get faster and faster and more accurate.
Finding the threshold where each surgical move would not be instantaneous.
When you start adding in that latency, it's a different ballgame.
Dr. Joseph Boyle is one of the top cardiothoracic and robotic surgeons in the country.
Yeah, I noticed it on that one too.
Boyle is one of 100 area surgeons documenting professional experiences at virtual surgery consoles called Mimic. In theory, these consoles could be connected to an OR almost anywhere.
Kind of opens up, surgery all over the world for the masses if it can be accomplished, and we can work out the latency issues.
The surgeons face those virtual delays and learn to compensate. Researchers are convinced robotic surgeons will be able to learn from these virtual procedures, setting the stage for a robotic telesurgery network.
So with the simulator, they get to do it over and over until they're really good at it. And when they sit down to do something like that on a patient, it doesn't trouble them at all. They've practiced, they know what to do, they know how to handle that situation.
As of tonight, Smith tells us 54 surgeons have already completed the virtual testing. He anticipates dozens more in the weeks ahead. Back to you.
And long-distance robotic surgery is not far off from reality. Smith says we could have doctors performing long-distance procedures within 10 years.
That's going to come like that, too.
Yep.
And if it works, it works. I think it's great. Technology's awesome.
Especially if you're not near a major hospital,
Right. And you want the top surgeon? He might be right here in Orlando.